Now, when I say benzodiazepines, I am talking about alprazolam, lorazepam, clonazepam, and diazepam. I was treating clients, as I am today, with general anxiety disorder, different anxiety disorders, panic disorder, OCD, depression, and I noticed I had this group of clients that no matter what I did, and believe me, I tried everything, were just not getting better. They were not making any progress at all. And I started really looking through their files to see what can explain this. It just kind of jumped out at me from their files that the clients that were not progressing were all taking benzodiazepines, different ones, but the same drug classification. The clients that were not taking benzodiazepines that had the same symptoms were all getting better, all making progress. So I started, of course, researching benzodiazepines. Everything I could read, everything I could find in the libraries, everything that I could find from the universities. And I found out a lot of information about benzodiazepines and what it does to the brain. I'm going to share an article with you. Actually, this article is from 2015. So benzodiazepines are one of the most widely used medications for the treatment of general anxiety. Although benzodiazepines have been beneficial and effective for short-term management of anxiety, when they say short-term, they are talking 2 to 4 weeks. Anything over 4 weeks is considered long-term. But they have not been shown to be effective in producing long-term improvement in anxiety. Chronic use of benzodiazepines has demonstrated multiple side effects, including cognitive impairment, decreased motor coordination, problems with concentration, social phobia, and depression. The development of tolerance, dependence, and withdrawal are some of the most significant problems associated with the long-term use of benzodiazepines. But to add to the list of negative side effects of benzodiazepines, I want to point out a few more side effects that are pretty scary. I talked about the side effect of depression. Also, we see quite a large increased risk of suicide. A poor reaction time, slower speed of processing information in your brain, and verbal learning problems. Agoraphobia, the loss of sex drive, increased anxiety with long-term use, and difficulties in memory. So benzodiazepines can be used in the acute setting of anxiety, but not longer than 2 to 4 weeks. That's what they're recommending for physicians. Being on a benzo really makes psychotherapy, any type of talk therapy, completely ineffective. I believe it has something to do with the memory problem of learning new information and being able to process it and put it from short-term into long-term memory. Because the brain is being numbed, you cannot create this new circuitry in the brain.
Very often, the general practitioner prescribes the benzodiazepine, thinking that the person will take a very small dose for a very short period of time, and it will tide them over. However, people, once they begin starting the medicine, discover that it does relieve their anxiety at the moment, but then hours later, the anxiety recurs, sometimes even stronger, because there's a withdrawal component. Tolerance means gradually taking more of the medicine, more frequently during the day, in higher doses. And some people experience withdrawal even when they're taking the medicine as prescribed because they're developing tolerance. That the same effect that they had on a particular dosage earlier is no longer present. That they need to take more and more medicine and need to take it more and more frequently. Then generally, after several weeks or months, they become hooked. There is really no psychiatric indication that makes it worthwhile to start a benzodiazepine. That whatever gain you might get in the few weeks after beginning the medicine in reducing anxiety, the risks are overwhelmingly so terrible that really no one should be given a benzodiazepine by a GP or by a psychiatrist for anxiety. Just not worth the risk. However, here's the problem. The benzodiazepines in the short run calm people down. It's a wonderful feeling. You were anxious before, pop a pill, you feel better. So it's the easiest way to get a happy patient out of the office to give them a benzodiazepine prescription. GPs in our world are terribly overworked. They get to see patients for an average of 7 minutes. They don't have a chance to talk to them, to understand their problems. The easiest thing for them to do to have a happy patient is prescribe a pill. It would be a much better world if we had GPs spend more time with patients. The more they talk to patients, the less likely they are to make errors in overprescribing medication.